Joining us now, Dr. David Weiland, Assistant Professor of Pediatric Cardiology and Electrophysiology. Did I say that right?
That's it. You got it.
All right. At the University of Mississippi Medical Center. So you're heavily involved in the subspecialty of heart rhythm disorders in children. Is that right, Dr. Weiland?
Yes, sir. That's correct. That's my area of subspecialty and expertise within pediatric cardiology is essentially disorders of heart rhythm. So not as much, my colleagues and myself to an extent work with, children born with congenital heart disease that leads to how the heart works. My expertise is what makes the heart go, the heart rhythm itself, and the things that can impact that and cause problems with that.
Okay, and also something known as SCA, or sudden cardiac arrest.
Yes, sir. So sudden cardiac arrest describes there's a few different disorders that ultimately cause the heart to abruptly stop beating in the appropriate fashion. Generally, the technical term for that is called ventricular fibrillation, in which the heart does not actually squeeze and therefore pump blood effectively to the body. And there's a few different types of disorders that go into that, but they all go into heart rhythm disorders, particularly in the pediatric population. The older population is a number of things that can structurally be wrong with the heart and the coronary arteries and things like that. But in the young adult and the child, generally it's a inherited type of condition that either affects the muscle cells themselves or how the muscle talks to itself to generate that rhythm.
Okay, so something that I guess you don't hear a great deal about, or I guess you wouldn't associate with children, is heart disorders and heart disease. But it does happen, and it always occurs to me that any sort of situations, health conditions involving the heart, time is of the essence.
Absolutely, and so you're absolutely right. Even when I was going through medical school here, I didn't at that time know a lot about pediatric cardiology coming in. I didn't know that was the area that I was going to choose to go into. And you sort of think about heart conditions as inherently being something that older individuals have. And so when I started to learn about it, I was like, what is this even going to be? And so there is as I've come to learn and love as my profession, there's a variety of things that can impact the congenital heart and then things that can be acquired, and we have a great team that I work with at the university that takes care of all forms of that, and so for sudden cardiac arrest, the most important thing, there's a few kind of ways that we work towards helping people with that, helping families with that, and ultimately, as we'll talk about, some trying to help communities with is time is of the essence. Rapid initiation of CPR and use of automatic external defibrillators, or AEDs, is very crucial in improving survival of patients that experience that condition.
Okay, so you are advocating for a bill introduced in the state Senate, SB 2750, and this would establish a grant to essentially, I guess, purchase and place AEDs in public and charter schools. Is that correct?
Yes, sir. And so the background of this a little bit was something that my mother also had kind of worked with. She was previous president of Mississippi State Medical Association.
That would be Dr. Jerry Weiland. Been on the program.
She's a good friend of the program, as they might say. And so the idea being that administered by the health department. Like you said, a grant set up as a one-time expense or expenditure to a smaller part of it to administer the parts that this goes into, but also to fund the purchase for public and charter schools and automatic external defibrillator. The technology has improved a lot over time, and generally as technology improves, it gets cheaper, but you're still looking, best estimate is somewhere in the neighborhood of $2,000 for a AED that you would want to have and use at a place like a school or a large community center. I think 1,900 is something a little bit closer to, but that's so it's an expense that is kind of challenging for a single school individual, a single school or even school board to really try to dive into when there's so many things they're trying to work on, teacher incentives, things for students, things like that. And this is it's a public health matter. But my mentor at Duke, where I trained, told me, like, this is a public health matter, but it's not something you can MPH in.
Yeah.
MPH is more for, like, hypertension, diabetes, things that are much more ubiquitous. But this is something that does impact, people, does impact the real world. And the other background to this was kind of something we started thinking about after everyone watched on Monday Night Football a few weeks back, where the Buffalo Bills player collapsed from. They will likely never say what the actual condition was, but whatever he had led to a sudden cardiac arrest, and he was defibrillated on the field, got appropriate treatment, is doing very well, and that is the crucial part of that unfortunately, when not visible and on a professional team, sometimes lacking. So that's the idea was sort of set forward from that to kind of try to bring this about and try to provide that for our public schools and charter schools in the state.
Yeah, so I got to say I'm a little surprised, Doctor, that we haven't already seen the distribution and the placement of AEDs in schools. And I say that because it just seems like you used the word a minute ago. They're ubiquitous. They're everywhere you see in public spaces. Heck, we even have one at our golf course. It's fairly common.
Absolutely. It's becoming much more common, and that is a good thing. There are a few challenges that go along with it. The first is that while it's like I said, it's more rare than some of the other things, but it's not necessarily rare enough for that we should sort of ignore the possibility of the kind of the estimates are somewhere around 4,000 children, young adults will have a sudden cardiac arrest event that falls into one of those diagnoses that we treat. And so while that number isn't high, it's extremely visible. It's extremely detrimental, obviously, to a family and to a community.
Sure.
But so it doesn't, at the level of, what a school is going to be looking at, what do we need this month, this semester, this year, that's probably one of those things that's hard to, really think about and say, oh, we're going to need this because this is going to happen here. And like the fire extinguisher, like everything else, like, yeah, you don't want the fire to happen. You expect not the fire to happen, but the fire happens. And
it's insurance. Essentially, it's just insurance.
Right. And so the other issue is historically people have been somewhat timid about the use of CPR and AEDs. Gotcha. with the thought that they might inflict harm. And that's our job. What we do is educate people that's not the case. Early CPR, early use of AEDs. AEDs do not discharge. They're automatic. That's the A part of that. They don't discharge unless it determines the rhythm is something that needs that for. This isn't like on the TV with the paddles and all that. This does it itself, and if it's not something that it determines is needed, it actually these days will tell you, shock not advised, resume CPR. It's already told you to call 911, and that's the first step of any of these events.
So is there a standard program, training program that the teachers would complete to know how to use the device? So
that's a very interesting question, and that sets up into, as it stands, as it's part of this bill, not necessarily. However, there are a few different systems and resources for the use of that. To give a plug to my colleagues and my institution, one of them is something called Project Adam, which does not provide funding for AEDs. That's always a little bit of the hard part for the use of that. But once the school has that, Project Adam, that one of my colleagues, Dr. Charlie Games, is heavily involved with in our state, and it's around a number of states, will actually provide resource information, training materials, and kind of sets up like, you remember doing the fire drill or tornado drills, similar sort of deal, like has stakeholders for who's going to use this, where is it going to be, how's it going to be displayed, who's going to check it. They are automatic, they run on a battery, but just like everything, they need to be checked about once every few months to make sure the battery's good, all the pads and everything like that. So that is a secondary thing that once, and these two things do kind of tie together because, we're trying, Dr. Games and we are trying to do Project Adam, but not all the schools have that yet. Tying the two parts together, and this is also kind of, it work across the country, will make that utility and make these capabilities more accessible and easier to use.
What's the status of the bill before you go?
Status of the bill, it has made it through the Senate and is up for consideration in the House from my understanding.
Okay. You feel good about it passing at this point?
I hope so. I mean, I think that there's some details need to be ironed out,
Okay.
but I think it's a good bill. I think that they should keep it in consideration, and I hope it makes it through.
Dr. David Weiland has been our guest here on Middays. Thanks for coming in, Doctor, and explaining that. Appreciate it.
Awesome. Thank you for having me, sir.
We're taking a break right now. Coming back in the Element Well Studios.